So tonight we're going to talk about thyroid issues.
Yes. So tell me, when you were picking this topic, what inspired you to choose this one? Have you seen lots of questions on it?
You know, I think thyroid comes up quite a bit in our group, and I kind of wrote out a bunch of questions that I've seen, and let me just throw this all at you. Okay. People want to know what does the thyroid do? How do thyroid hormones work? What are normal thyroid levels? What are supplements that can help your thyroid if you think you have problems? What are symptoms of bad thyroid? Are thyroid and diabetes related? If you think you have thyroid issues, what tests do you ask for your doctor? How do you treat thyroid problems? Can thyroid problems cause hair loss, acne, joint pain, neck pain, dizziness, anxiety, hot flashes, mood, and your eyes? So there's been quite a bit of talk about thyroid, and I thought it would be a good conversation.
Okay, pick one of those. Let's start with them, because that's a lot.
Let's talk about what the thyroid does and why it's important, and maybe symptoms that you may experience if you think you have something wrong.
Right. So it's a great organ to bring into the education kind of armamentarium for keto, because when you're looking at why people choose keto, sure, there's weight loss, but it doesn't take but a couple weeks into this journey to say, wow, my energy feels so much better. And when you watch the summary statements about how do you teach about thyroid, think of the thyroid as part of your throttle for energy, your throttle for how your body is running. And just like any dynamic engine, meaning one that can go faster and slower, there has to be this talking way that says, how much energy does your body need? And then how much can it supply? If you keep pushing really hard, asking for energy that you can't supply, the engine will have a collapse. So your thyroid is very important for kind of sensing how much energy is needed to keep the body purring along and meeting the needs. And it also is, if it starts to not work well, the throttle doesn't reach those demands. So you'll hear lots of people say, oh, I wonder about my thyroid. I feel low energy. I feel like my metabolism has shut down. You look at other ways that thyroid impacts the body. Their brain works slower. Their immune system works slower. Their hair grows slower. So they'll have hair loss, actually. All of these, if you can kind of back up and remember that thyroid is your throttle, like how fast, how much do you need? In a cancer patient, when they're repairing from chemotherapy, or they're trying to kind of keep the body going despite the destruction that cancer is doing on the inside, the thyroid needs to, step up its game and produce more throttle, more energy to meet the demands of that. If you're fighting an infection, the body will take out, and sense how much need does the body have. And I really find that when I teach about the thyroid, I start by saying there are all these symptoms that are related to thyroid disease and everything else that people say, well, if it's not my thyroid, what is it? I'm like, well, here's the deal. Thyroid, yes, is one of the things that connects all these things together. And the list of symptoms that happen when your thyroid isn't working well, people will get very focused on, it's got to be my thyroid. It's got to be my thyroid. And if the thyroid is meeting the demands, they can get really frustrated when they can't give the credit or blame to the thyroid. And in fairness, the thyroid is easy to fix. So that's, as a physician, if it's the thyroid's fault, I can help with that very easily. We can replace that symptom very easily. But when it's not the thyroid's fault, it becomes much more complicated. So when I look back over the last 20 years and the first few years of my practice, I would prescribe the thyroid medication and take care of it. Now, even if their thyroid isn't functioning at its best, I'm much more careful to say, okay, so your thyroid can make up for when your body does need a little higher throttle, but it's only going to be able to kind of step up its game by a layer or a level. if you've got like fibromyalgia, chronic fatigue syndrome, adrenal fatigue, your whole body is just slow and, really having a tough time. And I add a little thyroid medication, people expect like it's going to be magical and they're going to feel so much better. But the truth is, we have a mitochondrial problem, which are these little bitty places where all the energy is made. And that is where the ketogenic diet can really help, resurrect or really restore the energy coming from the cellular level.
So you're saying that the thyroid is just a problem that leads from the mitochondria issue, which is where you start in fixing something would be your diet.
Yes. I mean, that is, such a powerful message that I did not teach that when I was first in medicine. It is only in these last few years of really understanding the metabolism through changing the fuel to a ketone as opposed to glucose, and knowing that the symptoms will look just like thyroid disease when their mitochondria are saying, hey, you're asking a lot of me and you're feeding me that really crappy food called constant carbohydrates, and you're asking me to keep going, but I'm working through a bunch of sludge and inflammation, and the fuel you're feeding me isn't very good. And all of those symptoms look just like my hair is falling out. I can't, my brain doesn't work well. My energy's low. I'm gaining weight. I even have some, stretch marks, those types of symptoms. They'll Google it and think, it's gotta be my thyroid. You need to replace my thyroid. I'm like,
so let's say somebody really does have a thyroid issue. First of all, what kind of doctor do they go to, and what are all the tests that somebody should ask for?
Right.
Just to rule out this that you could fix. I know we should definitely start keto. Everybody should, I think. But,
everybody should.
Yeah, I mean, reducing that inflammation is going to help with just about everything. I don't think I've found something that it didn't help.
Right, from teeth to toenails. I keep saying, you can't believe the things we can find that get better with a ketogenic diet.
Yeah, but let's say somebody really does have a thyroid issue, or maybe they think they do, and all those symptoms that we know or Google or whatever, it's got to be the thyroid. So how do they know? What tests do they order? What doctor do they see?
Right. So any primary care physician. The beauty of thyroid disease is it used to be, and I'm talking, this is the 1990s, the lab tests at that point were not nearly as good as they are now. So there's a lot of mythology in, you got to make sure you get this special test. And I'll be honest, I've ordered all of those other tests before. 99% of how you make the decision about whether or not they have thyroid problems comes down to a couple of easy, cheap tests. You do not need to spend $600 on thyroid tests to know if you have a real thyroid problem. When the thyroid's not working well, the signals from the thyroid and the brain start to mismatch, and your primary care physician, even an Instacare doctor, could order these thyroid tests. So there are advanced doctors that saying, you know what, we've done the first layer of tests. If you want a more advanced specialist, we could go to an endocrine doctor who specializes in thyroid. But as those endocrine doctors teach the primary care physicians the mistakes we make, we often talk about we're using thyroid tests inappropriately. We're ordering way too many of the fancy tests. We need to start with some of those basic tests, save the money of the patient, and know that thyroid is a great mimicker. It's going, there are going to be other things that look like thyroid disorders. So there's two major ones that should be ordered, and then some other ones that aren't difficult and usually aren't too hard to talk your doctor into ordering. The first one is something called a TSH. So TSH, I can tell you what it stands for, but if you just write down TSH, there's only one test called that. And it is the signal of the brain telling the thyroid, hey, we have this metabolism need. This is the needs for today. And it will send the message to the thyroid. So we can measure how much. It doesn't just have a wire that connects the brain to the thyroid. It produces that hormone, and that hormone floats around in your blood. So when we do a blood test, we can see what is the message, how loudly is the brain speaking to the thyroid.
Okay.
And the second thing that we look at is something called a free T4. And free T4 is not the active part of your thyroid. It is the inactive part that is produced by the thyroid gland. And once that T4, again, it releases outside of the thyroid and it floats around in your blood. And so as it's floating around in your blood, it's going to land on the cells that need the thyroid throttle message. And so once in the cell, we take that T4 and we turn it into a T3. But T3 is active inside those cellular messages. So the beautiful part about the T4, which is the other blood test, so you got a TSH and you have a free T4. The T4 can get past the lipid layers that each cell has around it. So when you're checking the blood levels, the two biggest blood tests that teach us most of what we need to know is what message is the brain sending to the thyroid? And then what message is the thyroid sending to all the cells? And even though your T4 is not the active part of your thyroid, it is the major message carrier in your blood, which is where we do the tests.
Really?
So if we had,
that sounds pretty easy. I mean, a primary care physician can order the TSH and the free T4. If you have problems or you need to see a specialist, you mentioned an endocrinologist.
Yep.
And then, of course, start with diet first, because that's what's going to really promote and help the mitochondria get started.
Well, and I think that's the part that I wanted to make sure we covered tonight was, so there is a test out there. If you Google it, you'll hear some of the, I don't want to say conspiracy theorists. They're just trying to be as thorough as possible, saying you need to do, your free T3 as well. And if they don't check your free T3, they're really not paying attention. They're being a bad doctor. And that's not true. It's just that what you get from the free T3 isn't nearly as impactful as what you get from your free T4. There's also something called a reverse T3, and that is, it's a different, it's an inactive part of the thyroid. It is found in your blood, but it is not, it's not nearly as helpful as looking at your TSH, your free T4. And if you want your doctor to check a free T3, check a free T3. And again, most of the decision-making is made from those first two tests. There's a small amount that you can make from the next test. The reverse T3, I know there's a lot of docs out there saying, oh, you got to make sure they do this. Yeah. And I would contend before I would spend the extra money, because most insurances won't cover that test, before I would spend the extra money on that, I would have my patients be keto for 2 months and say, I know that you want this to be the thyroid's problem. They don't want it. They're just looking for an answer. And thyroid is easy. Yeah. But if you can just trust me that if we change the fuel that you're giving your thyroid and you go from lots of sugar to ketones, you are going to be amazed at how many of those symptoms that I know Google says is related to thyroid are now going to be better when you're on a fuel of ketones as opposed to a fuel of glucose.
For sure.
So it's not that I don't do reverse T3, but I do that after they've been on ketones for a couple of months. And you're like, isn't this a better answer? And almost always, I rarely have the patient who, once they have normal thyroid labs and have really stayed the course, come into support group, trying to know that this is hard. The steadiness is where you find the power of improvement. And we all have had struggles. And then watch to see what happens by that 8th week, that 2nd month. And those symptoms of low thyroid, which probably were sluggish mitochondria, are starting to really say, oh, we can do a better job here.
So please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.